Russ, I'm going to kick it over to you.
Hey, thanks, Richard, and good morning. Welcome from everybody at Venue Solutions Group and the International Association of Venue Managers. This is the next set of 6 free webinars that have been designed specifically for public assembly facility operators and focused on back to work. This is a pretty important time for all of us, and while the timing is different depending on where you're located, I think there's enough optimism right now to be saying, hey, we need to be ready. We need to be thinking about all the things that we can do to make sure that our employees and our staff, as well as our business partners and guests, are going to be ready to come back to a public mass gathering environment. Really excited about the guests today. We are also excited about our partnership with IAVM. This allows us to make sure that we do our part and bring value to our industry. And so with that, I'll kick it back to Richard.
Great. Good morning again, everyone. And we are thrilled. We've got 3 stellar panelists today, and I guess that's why we've had such an amazing uptick in registrations. Everyone, I believe, well knows Kim Stone from the Chase Center, Kameron Durham from Sofi, and Juan Rodriguez, who's fresh home from the Super Bowl, but runs our MLS facility in Houston. When I say ours, I mean the MLS League, and we're thrilled to have all of them, experienced veteran and highly respected industry leaders. So let's jump right into this. The focus of our session today is around helping all of us better understand best practices for getting people back in our building, and it starts with employees. One of the things all of our research has shown through our VSG training and management is that employees not coming back will stop us from being successful, and that's the biggest concern we have as venue leaders. So the question I want to ask, and Kim, we'll start with you, and we'll go around. If you could only do one thing to build confidence with your staff coming back to work, and you haven't quite got open, but you've been spending a lot of time focused on it in California, what would you do if you could only pick one thing?
Educate them. Let them know everything we've done during the past year to improve the safety. We always tell our staff and our guests that the number one thing we do isn't actually hosting Warriors games, it's keeping fans safe. And that used to be keeping them safe from physical threats in terms of like mass shootings, bombings, those sorts of things that used to keep us awake. And now we've added the virus to that. So it would just be very transparent communication and education about what we're doing to build their confidence that when they come back, everything that we have done makes it safer for them to come to work than to go to the grocery store.
Terrific. And we'll come back and maybe ask you some specifics on those in a second. But Juan, let me go to you next. If you could do one thing, what would it be?
Well, I think Kim's is probably the biggest one, and I'll use not to toot his horn, but to use Russ's one of his sayings of science trumps emotion. I think that's the biggest thing. Everybody's emotional right now about being scared, being worried of what it is, and I think the biggest and number one thing, it wouldn't be anything different because education solves a lot of the perception problems or the perception issues that can arise in the workplace. So I think taking them through the science behind why the decisions that we're making, why the processes that we're doing, and include the information that we're getting from the medical staff, that it's not just us as venue operators or their supervisors, so to speak, coming up with these solutions, but actually that there is science behind it. There is why the frequency of cleanings, why the different things, only because it helps them develop not only in a business, but hopefully they take it home, which means then that they don't bring it back to work. The things that they can stay safe can help them. So I think education, I wouldn't change anything because I think that's the number one thing. So
great insight. So building on Kim's insight that for her, the number one thing is to make sure we're educating. You're reminding all of us that being factual, science trumps emotion. And Kim used a really important word as well, too, where she talked about transparency so that management and leadership is believable. Cam, as you hear those 2 points, build on it for us, please.
I would just add, I agree with the education side. I would just add empowerment into the word. And when I say empowerment, adding them with the resources they need to be able to do the job while they're there with the proper PPE, proper signage, other things that we can do to make sure they know that we are taking their safety seriously. With that education, that gives them one of those resources that'll help them to be successful.
So great tip off and great lead in here for. So let's talk a little more specifics, get a little more granular. If we were to ask the three of you, as you're communicating to your staff, all of you said educating them, making them aware, preparing them to come back is really number one to you. We want to ask, I think all of us in attendance here want to ask, so what are some specific things you're doing to carry that out? How are there any unique things you're doing with training, with communication, with preparation in your building so that they hear that? Juan, let's start with you.
Sure. I think the biggest thing is listening. We've held something similar to this, where you want to call it a town hall or an all staff meeting, and we've all sat down and listened to their concerns, to their to what they would see, what their perceptions are, what their thought process is, and I think listening to the staff as well, and then coming back with the appropriate solutions, giving them the resources, as Kameron said. I think things we've done is provide a care package when they walk back into their office with masks, with hand sanitizers, with different things to resources, that they get this bag of almost a welcome basket, for lack of a better term, coming back to work, that gives them those type of things. And that all gets created from the things you hear from them, so that you can kind of go back and listen to what their worries are. There's many right now that are taking care of their elderly relative or parent or whatever it may be, and so there's a lot of concerns out there, and I think that's a big one of the listening in the town halls, to hear back so that you can find the appropriate solutions. I think we're all learning, so none of us know the actual solutions to everything just yet. So I think that's a big piece of it.
It's great insight. So listening, and I've often heard, and we use this even in some of our own processes, that people don't necessarily, and this is what I hear you saying, people don't necessarily have to be right, but we all want to be heard. And when an employee is telling us that they've got a concern, the last thing we want to do is not be empathetic. We want to hear about it and whether we can address it or not. So Kameron, let's go to you.
No pressure. Sorry, just to add, not pressuring them, not feeling pressured. I think that's a lot right now, is people think, I have to come back. I have to. And that creates more stress than anything else.
Good to know. Cam, same question in terms of specific communication.
Well, our communication has started, throughout the building, and we've extended that to our partners. We've developed a comprehensive training that everyone's a part of. Everyone has their buy-in on it. We track each person to make sure they're being accounted for on the training side of things, and then we just make sure that we do what we can to continue, like you said, like Juan said earlier, to really listen and be responsive. But not only be responsive, but also be proactive by continuously reading, trying to understand the different trends that we're hearing or reading about. We're very fortunate that we have a person like Russ, who's in-house, that helps us to be able to kind of keep us on track on different trends that are coming up, to be able to address those things, as well as to be able to benchmark with fellow team members and buildings, to be able to find out what are the trends we can use to help to kind of incorporate what's good that we can use, what can we change a little bit to modify, whatever we can do to try to adjust in different ways.
Great insight. And Kim, ask you to kind of flavor that as well, please.
Sure. I mean, Juan and Cam have really covered a lot of it. In the NBA, they have specifically mandated some training that we have to do with the staff, which is we support 100%. And then in addition, going back to like what Juan said about, and you've mentioned, Richard, about really listening to the staff. We've been surveying our staff throughout the whole COVID period, just on certain topics to see what they're thinking. And then we've done a trend as it relates to each of those topics, so we can anticipate sort of where things have shifted over this time in COVID. And it really coalesces around a few items like the PPE, public transportation, getting to Chase Center in our situation is of a particular concern. So we're starting to address those. And it really is almost a one-to-one communication strategy that you have to give them that confidence and that transparency. And if they have a question. So as we look to get back on board, we're also, I'm sure Juan and others, we're making sure that everybody is coming out of COVID, at least in the Bay Area I can speak to, with sort of different understanding. Things have changed, science has shifted. What can be done 2 weeks ago, now you can do it. So it's very confusing. So we're trying to level set with everybody about here's what you can and can't do at Chase Center, just so that everybody doesn't misinterpret something. And so that education and level setting for us is a big lift. And we're hopeful. We haven't gotten any official word on fans, but you see everything is happening so rapidly. New York opened up. So we're hopeful here in California. I'm sure Cam is too. So we're already pretending like we're going to have fans, even though we're not yet. But I think it's just getting ready.
Yeah, and you tee up a great question that we want to move to, Kim, and thanks for that. And that is, you mentioned how rapidly things are changing. Today's info is potentially different 2 weeks from now, and we've all seen that in various phases of mask wearing, or that the COVID is highly transmittable by touching surfaces to maybe it's not so and we do have Russ, who's clearly an expert on some of these things because of many of the committees he's on. But we'd like to move more towards, in terms of preparing your venues, and we'll come back to a few policy things a little later, but as you're preparing your venues, there's all sorts of technology out there. And some of it's relatively inexpensive and some of it's not. So Cam, we'll start with you at Sofi. And you have an unlimited budget, right? You can buy anything you want. So tell us a little bit about your experience there. And remember that, probably, the majority of our people on here don't have those big budgets.
Well, I can say this, although we have a very large building and have a lot of expense that's put into it, budget wise, we have to be very conscious of things. And so, especially this year, considering that we did not have guests in our building. So that obviously means that we didn't have a lot of revenue coming in the building. So that meant that we now had to be creative in how we were able to come up with low or no cost ways to really motivate our event staff, because our focus went from going from usually we're looking at guests and team members to now we're focusing primarily on team members because those are the folks who are here. So we had roughly 200 to 300 employees easily that we came in and worked every Sunday, either Chargers or Rams games. And we partnered with our various tenants, with the Rams and with the Chargers specifically, to be able to come up with things as game balls, incentives that would be able to allow our staff. Sometimes they would just catch people doing things the right way. It would be a hat or a pin or something to let them know that we appreciate them fulfilling our building service culture elements, our commitments, as well as our purpose. And those things went a long way towards our event staff wanting to come back and see us each Sunday.
Great, thanks. And I sort of knew, just to be fair, that by teeing Kameron up with a big budget, we've had the conversation. They've had no revenue for a year, so their budget's no different than all the rest of us. And that with no revenue, we're all really trying to pinch pennies and do everything we can to be efficient and effective. So Kim, same focus in terms of the sort of physical things you might be able to do at Chase Center. It's a beautiful new best-in-class arena. What are some of the things you've looked at? What are the things you're trying to do, both high-end and economical?
Sure. We're the indoor facility, and it seems that there's 3 areas of focus for our health authorities as it relates to indoor settings. 1 is air quality, 2 is mask wearing, and 3 is the social distancing. So social distancing, mask wearing, that's pretty low cost, no cost. Everybody's going to bring their mask, and then we'll create our manifest that's socially distanced. But when it comes to the air quality, this goes back to what you said. We are fortunate that we have a state-of-the-art system. Mike Woolley, thanks to his great work when we opened, he was here every day sitting next to me, helping us get our whole systems up and running. And what we've been able to do is we are able to bring outside fresh air into our bowl and refresh it every 4 times an hour, which is really good. It replicates and meets the standards that the city of San Francisco has told us we need to meet. So we've been able to do that. And that took just a reprogramming. I say but it was a big effort to reprogram our building automation system. We got our engineers involved, but they were terrific. And it just really took that sort of collaboration with our partners. The second thing we did was we were able to replace our air filters. We were installed with a MERV 13 filter, which I think most of ASHRAE requirements say that's kills COVID, is probably an oversimplification. We've been able to take it up to a MERV 15 filter, so the weave gets a little bit tighter. I explain this, and most of you probably know this, but I explain air filters like masks, right? So a MERV 13 might be like, the surgical mask that you wear, and a MERV 15 might be more like an N95 for a ventilation system. So that's what we've been able to do. So we feel really good about the air quality. We looked at some of those technologies like the UV lights and those sorts of things. It's just not where San Francisco wanted us to go, right? For here in San Francisco, it was more about fresh air. And so we've been able to do that. And we proved it through the science, using what Juan mentioned and Russ has said is using the science. And then in terms of low cost, no cost, because I know we're all of us have had, or most of us have had no revenue for the past year. In terms of low cost, no cost, going back to consumer confidence and staff confidence, you know, if you think of, everybody's got a phone. All those phones have video capabilities. You can make your own low-cost production videos to show your staff what the experience is going to be like when they come in. You can show them what the flow is going to be. You can put it on YouTube. It doesn't take a multi-million-dollar Hollywood production to give them this confidence, just so that they know and understand what they're about to experience and how it's a little bit different. And you can use those channels. I know you have to be careful, but in terms of low cost, no cost, that's an easy way. You know, I have flown JetBlue. Yes, I've flown during COVID, and I flew JetBlue. And their video, their intro video, and then the graphics that they have on the back of the seats are great things to emulate. I know in Atlanta, Brett Stephenson and his team did a great job reaching out and partnering with Delta, and using Delta as a strategic partner to help them understand the behaviors of guests as it relates to what they had been experiencing in Atlanta airport. And that's a phone call to your airline partner or a phone call to somebody you know at the airport, so you can get information to anticipate from some of your great partners. And those are some of the low cost, no cost that maybe all of us can do. And I think the other thing we've done is we've reassigned staff duties. So people that might have been doing event staffing manager, now he is doing some of our testing. I've got an event services person who is now my testing officer, right? So just repurposing that staff into roles that can help you really focus, because you can't do it all. And just having staff be flexible are just some of the low cost, no cost things we've been able to do.
Great insights. And Juan, to you, same question. Thank you, Kim. That's amazing.
Sure. I think the biggest thing, for us, not because budgets are realities, and we've had the opportunity to actually host fans as well. So last year in September, October, and to many people's point, sometimes COVID doesn't exist in Texas. They do things a little differently, but it's still trying to create that comfort and safety of coming to the games. And surprisingly enough, we did a lot of those things with human resources. And when I say with human resources, not the department, but actually using people for more frequency cleaning, things that people actually see, the fogging in certain areas and electrostatic cleaning and those type of things, where we haven't done as much with equipment. We are an fully outdoor stadium, so that creates a little bit different. You can't go do certain things in the bowl and be as effective as maybe an indoor facility will be with filters and those type of things. So a lot of what we've had to do is use actual labor and power, which actually has solved two issues. Number one is getting people back in the workforce, and how excited they've wanted to be back. Obviously still concentrating on making sure that they can kind of see the science that I keep talking about, and those type of things. So I think we've used the people resources, the more often the increasing the frequency of cleaning, etc. And that's how we've done it with I don't want to say low cost, because it's not. Obviously the labor has increased almost threefold in the building, but it's not the infrastructure or the large ticket equipment that has been kind of thrown out there. And every day, just like we're seeing about COVID, as you guys mentioned, how it changes every day and how the science changes of what you can use and what not. We haven't really gone out and invested in a lot of infrastructure because it always changes. The hot and heavy thing was thermal cameras for temperatures and so forth. Well, if you've ever been in Houston in the fall or summer, you're going to be 140 the minute you walk out the door, not any other time. Last week it was in the low teens or single digits. Today it's going to be a high of 78. So that humidity and everything, some things just won't work in certain settings, which may be the sexiest thing that people are reading about. So we've been more visual with our staff and physical with what we do.
Terrific, thanks. We changed gears a little bit back to personnel and training. All three of you had great insights for us in terms of the sorts of things you're focused on with your teams and building their confidence and not putting pressure on them and listening to them and the empathy aspect of that. And I also actually want to add, when Kim was talking, in fact, all three of you really weaved this into what you had to say. What I think we all consistently heard was, look, you know, we need to lead with a light touch in a lot of ways here. We need to show empathy because this is a challenging time, as Juan was pointing out. People are hurting. This job's not the only thing in their life. And so we have to remember that. And I remember a great line I once heard, which is attributed to a lot of people. I attribute it to C.S. Lewis, is people don't care how much you know until they know how much you care. And so as we all show that we truly care about them, people over outcomes, it's the long game, and clearly what our three panelists are sharing with us. So shifting to the training specifically, we know this is really challenging because in the old days we'd get, which were just 12 months ago, we'd get 12 or 20 or 300 people in a room, and we would have an agenda, and our various people in charge of that would provide the information and break them into small groups and sort of shake hands and kiss babies and go home, and everybody had the information. Today, that's not so easy. So specifically like to ask you, if you haven't started training yet, what you are planning on doing, because all three of you have obviously advanced this. And so the question's kind of twofold. Are there unique things you're doing that are tying in this let's get back to work safely post-COVID? And then also the actual process you're using. What are some of your plans for how you're going to effectively train your employees for this new world of how to get people to wear masks, et cetera, et cetera? So Kim, if you don't mind, we'll start with you on this one.
Sure, happy to. We're looking at, everybody's virtual, so we're doing virtual trainings, and then we're also doing the online learning management tools. So you can go in and you can take a session, and I think Cam had referenced it, that will track if they've completed those trainings or not. And then we're going to do a few in-person role plays. You know, we're going to have to do it carefully. We're going to have to do it socially distanced. But I think maybe for our supervisors, we'll focus on them, having them come in and anticipate what the building looks like. I don't want the first time the staff to come into the building to be when we have fans, because we have had to redesign. The NBA has been very strict, has created color zones, and you no longer move around about the building the way that you did pre-COVID. So we need the staff to come in and see that and understand it and make sure they get comfortable. And it's all for everybody's safety. So those are sort of the areas we're focusing on. And I really want to go back to, I think you guys have really hit on something, which is just the mentality of the mentality of the staff, meaning everybody is tired, everybody is mentally exhausted, mental health is in a crisis. And so just the empathy can't be overstated. And just listening to them, talking to them, caring about them is so important and critical. And it's a big lift. I'm sure Juan's done it and Cam's done it. We've done it on a very small scale because we have fanless games. But I just want to put an exclamation point that I think, based on this conversation, I appreciate you all mentioning that, because I think it even brings, I just think that went to probably number one on my list of things to focus on as we come back in. So thank you guys.
Great, thanks, Kim. Kameron, in terms of Sofi and your preparations, and you did touch just briefly early on about the online learning tools, but what are some of the programs you and your team are preparing or to implement or have implemented to get this messaging out to your staff, and anything unique you're doing? And I think also I want to reiterate, a lot of our attendees today are just like all of us, they're watching their pennies. So what are some ways we can do this that don't break the bank too?
For us, we really are taking the advantage of really trying to find a way to continue to make it an adult interactive learning experience. And so we've found a way to be intentional in our groupings. Instead of having larger groups of hundreds, we're trying to break it down to 100 maybe, or 50 people in a session, with a couple of leaders that are able to keep people engaged with intentional breaks in between the different groups to the sessions, to really give people a chance to really absorb it. You know, you only can take so much before your butt says, I can't do this anymore. So you really have to understand it's important that we break it up, you know, 20-minute module, take a quick break. You know, bring in some fun activities. We've done things where we do quizzes and little competitions in the middle of the training to give people prizes later on, to keep people engaged, and then just working on just teaching back to make sure they're understanding what's happening. I like what Kim said, and I really want to just double down what she said about we are a access for people outside of their home. Some people haven't had a chance to leave their homes. Some people have a chance to get a lot of human contact. So we really want to make sure that when we're in the training, give them a chance to feel connected to us, and really feel like they are part of the family. So we really spend a lot of time really continuing to communicate and let them know that we're here for you. If there's things that we can do for you, give them a way to be able to give us feedback, and keep the dialogue going on outside of the training as well. So those are some of the things we do. We work. Our systems that we use simple Google resources that we have. We have a great IT department who's really worked really hard to develop some great ways of using, you know, Google Meets and other things to be able to extend out our training and quizzes and other things that we're doing, so people have an opportunity to be interactive. And we're also working on, hopefully in this phase coming up, doing some breakout sessions in the middle of training, so we can be able to go to some of our area managers, take smaller groups of 5 or 6 people, and be able to do some other things outside of that are related to the different topics. And once we're done with the Google Meets, hopefully portion, I'd like to see us do more of a socially distanced walk through the building, similar to what Kim said. Don't want folks to be, for the first time coming to the buildings, when they see guests, give them a chance to walk through the building, get a feel for the building, get a feel of their workspace, of the area, know their area code. So their zip code, which I would say would be, you know where your restrooms are, know where all your resources are, so they can be able to be more effective and be empowered to provide great service when we do have guests coming in the building.
And you're particularly challenged in that, because when you reopen, it will actually be when you open, even though you've had events, you haven't actually loaded up full of fans yet.
Yes.
So I want to, just before I kick it over to Juan, I want to reiterate something, just wearing a training hat, from my own experiences as advantage training. Kameron talked about smaller groups, and if you tune in for a second here, just listen carefully to this. Transformation happens in small groups. Now we know that, and it sounds cool, but it actually has the benefit of being true. So when you have 50 people in a room, or 30 people in a webinar, or hundreds like we have today, there is learning that goes on. But transformational learning that goes from here to here happens in small groups, because many people will not interact when they're in a group. And science, this is science. When a group's more than 8 or 10, it's a small group theory. So I really encourage you to listen to that great point he made about the things they're thinking through, particularly in this post-COVID world, where we may not be able to bring back people into larger groups for a while. That small group online participation is absolutely doable. It's affordable, and it really works, especially when it's led effectively, as you'll be able to do internally or otherwise. So with that, it's just I didn't want to skip over that point because it was so good, Kameron, and thank you for that. Juan, as we take the same question over to you, what's going on with you in Houston?
Well, I think a little bit of what we've kind of done with our trainings is train as much of the staff and have the dialogue as to what they can do, and as far as personal responsibility, or how they take what we're doing or what we're expecting to do here at the facility and what we do on a regular basis, is how they can take it to their homes. How do we benefit them for that? So having during some of those staff meetings, having the health department come in and speak to the staff and let them hear it from not just the facility, but what's going on in the city, kind of a state of the city address or conversations, and let them hear it from them, so that whatever we're doing here, they can do at home, or change their cleaning frequencies at home or anything. So we've taken the kind of the task of how do we better your environment personally, because at the end of the day, it's gonna kind of snowball into the work life as well, or vice versa. So we've done a little bit of that. Also, anything that we go over in our presentations, we've created documents for our return to play for the fans. We've created these documents, return to play, for the staff. on the facility side, but we've done the exact same thing on the office side. This past Monday, we started welcoming back our ticket sales staff in a social distance environment into our offices now again, which is it may be unheard of in some situations other than Florida, but we started that. And what we started doing is we gave them the same document that we presented in the in our trainings and our presentations to them before we did it. Immediately after the meeting, boom, they received that same document with all the things that and detailed list of that we gave to the staff, which, Richard, just by the way, we are 100% transparent. Whatever you guys want that we've used as far as tools or anything, they're welcome to everybody. We aren't experts. We're learning every day. So, but what we've created, I will be more than happy to share with anyone that asks. But I think that's been the biggest thing because they use it as a resource. I can't tell you in the 2 days that we've been open to this office staff, they've kind of called us on it. Hey, you said that there was going to be, wipes in this area. We didn't see them today. They were all out. So I think everybody's policing each other and helping it create a better environment. So giving them those resources back. And actually some people have also emailed us and said that what we did here at work, they're now doing at their homes as well. So that to me says it's kind of sinking in. But giving them the same resources that we have from the health departments, et cetera, I think it's a big tool because all you see is the news and that's all you can go off of. But sometimes getting firsthand, hearing it straight from the horse's mouth sometimes makes things a little different of how it's received. So as we're perceived.
As we pick up on what Juan just said, and I know it's not lost on everyone, but again, to underscore it, the culture that he's created in his organization, which certainly Kameron and Kim have within theirs as well, and many of us on this call, it's so critical that it's not we against them. We're all in this together. And Juan, thank you. I'm sure you'll hear from many people here asking you for their input as well. You mentioned health department, and actually Kim and I had a conversation the other day about this, and just in general, do you work with or do you avoid working with local officials? And I know where she and I both fall, and I suspect most people fall, but why don't we'll go around kind of quickly here. But Kim, what sort of things are you doing? Challenges have you faced through this COVID, and are there things you're doing with local officials that are maybe helping you try to sort it out?
Yeah, thanks, Richard. They've been a great partner, the San Francisco Department of Public Health, and they got thrown into this just like the rest of us did. And they have approved all of our plans. We had a tree giveaway on our plaza and we had to do a full health plan for that. And so we have had a lot of contact with them. And so through those contacts, even for these small events, we've built trust and a good relationship with them. Prior to this, the organization in our company that had the relationship with the health department was really our food and beverage provider, and now it's become like myself and our VP of Government Affairs and our president, right? So we're at that level, and they've been great partners. The state has been extremely busy, as you can imagine, and we haven't had as many touch points with them, but we are able to reach out to them. It helps that we built our buildings, so we had already established some good relationships with a lot of the local influencers, I'll say, in those areas. There's a saying that we've all heard that you don't want to meet, the fire chief when you have an inferno in your building, right? You want to make sure you've met the fire chief well in advance of that, created that relationship and that trust so that when that happens, you're not starting from a bad and negative situation. So I would just say to everybody and encourage you, they in our situation, they are our partner. They are not our adversary. And we haven't locked horns with them. To the contrary, they think and come at this from a very different angle than we do. So it really is a lot about sitting down. I think Juan said it a lot, listening to each side, having a good conversation, not getting upset when they don't understand. Remember, they're government, we're private business. There's, sometimes things take longer to translate. So just having patience with them, understanding they're important, making them into a partner, bringing in the right people, escalating up as you need to. And you will run into some who are probably a little overreaching, they're a little overbearing, and just knowing how to handle and maneuver through that is important. And I would imagine many of you probably already have really good relationships throughout your communities, and just leveraging those, because you never know who knows somebody in the health department if you're having a hard time. So, tap your network if you need to help you, reset a relationship if it gets a little sideways during this.
Those are fantastic words of wisdom, and just great. I'm not going to actually go all the way on the panel unless somebody has something they really want to ask or answer, because watching our time, we do want to get to welcoming guests back, and also want to take just a couple of minutes
Richard,
before we go ahead.
Rich, sorry, just to jump in on Kim's word of partnership. I think it goes both ways, being us transparent, what we're trying to accomplish, but at the same time, we as facilities or teams have a very big voice in the community, and helping those health departments get their messages out as well is incredible. I'll use, back in the early times, a big Hispanic contingent here, and many people kind of add or put together soccer in MLS with Hispanics, and they were having a problem where the cases were becoming very strong, and the numbers were growing in the Hispanic community. So we used our players to be the voices of the health department's messages or the city's messages. We even went out to some of our clients from a Mexican teams that come here often. They even sent some videos in to help us get the messages, so that there was that familiarity between not just regular stars, but hey, if you ever want to see me in Houston again, you need to do this, but in their language, sort of each other speaking to each other. And I think all of us have these quote unquote resources sometimes with players, stars, etc. So giving them those resources for the same resources that we're asking back. And I think the biggest word is partnership, public-private partnership. That isn't always the case, but it's amazing how during crisis and during challenges, we all come together as one community for the greater good. And I think that, to me, is, don't look at it only as a one-way street. Look at it as a two-way street. And I think you get more with the city and those local partnerships. Sorry to jump in there.
No, don't be sorry. That's brilliant. I'm glad you said it. And all four of us are nodding our heads up and down going brilliant. I'm sure all the attendees are as well. I'm going to jump to a question about what we're doing so we've got all this information, training, we've got staff that's coming back. We haven't pressured them. We've been listening. We're creating a safe and secure environment. Let's assume all of that sort of nudges up to the dock in a nice, secure manner, and we're able to get our buildings open, the staff well, and they're prepared. How are we communicating that to the people that are buying tickets? How are we telling them it's going to be safe to come back to venue XYZ? And Kameron, I know this isn't directly under your purview, but you folks all communicate well within the Sofi culture. So tell us a little bit about what you're preparing for in your venue, and then we'll just go around on this and get a couple of words from each panelist.
Sure, we're already working on a lot with our marketing department and communication team, a know before you go campaign, really working with the teams to really, how do we communicate that out and distribute what are the key facts people need to know from the time they plan to even thinking about coming to SoFi Stadium, to what they expect to see when they get here, to what will happen on their way out when they leave. We want to make sure they have all those steps in place. So we're working on doing that in a small, simple, to understand, and short, as concise format as possible. So we're doing those things. We're making that not only as a video, making it on the website. As I said, going to try to really make it a bigger part of a campaign as we get closer with the teams, and really getting it to be part of their process. And then the same as with our team members, doing the same thing, coming with a know before you go type of situation to make sure they understand exactly what they're expected here. We also are really working hard to really just not only make sure they know, but also when they're here, really make sure we spend a lot of time, make sure people see the things that what we plan on doing, holding ourselves accountable to that. By great example, that will be our housekeeping. We'll probably see more housekeeping, as Russ would say, than you've ever seen in the past. Really making sure they're visible, that people know that there's a hygiene sanitation team that's around to make sure people can really understand and keep that confidence to know that we are not just giving lip service, that we actually do mean it. So those are some of the things we're kind of looking to work on, how we can make sure to get more visibility to our getting here, when you're here, and when you leave.
Terrific. Thanks, Kim.
And I would say, I mean, Kameron, this is great. We've been sharing the the one fortunate thing about being in California and being probably the last ones to come out of this is that the collaboration, Juan's been great at sharing, others have been great at sharing. So we're just, imitation is the sincerest form of flattery. So we've seen some best practices from a lot of our counterparts. And so we're using those. And for us, the difference will be, we're putting this out as a massive campaign, probably on par with when we opened Chase Center in terms of the media, our social media. We're one of the biggest brands in terms of the most followers on social media. So we've been leveraging that throughout COVID, and we will continue to activate those channels for communicating. So it goes like a funnel, right? The top is this big local campaign, marketing campaign, and then it comes down to using our social handles, which are people have opted into that. And then it'll be one-on-one. We're going to use our season ticket membership staff to have the one-on-one conversations, to answer those questions, to listen, like Juan said. So each level of that funnel, so to speak, will have all the same talking points, but be able to be transparent, to make people feel like they're being heard, and then to make sure that people understand, and that we go back to level setting. So it's really activating all our channels. I mean, for us, this is an opportunity to reopen again. We were only open 6 months, so it's our opportunity to reset, and we look at it that way. And so all efforts of the organization are focused on it. So excited to see it happen. It's a big undertaking, but it's a wonderful opportunity to get everybody in the organization involved.
Terrific, thanks. Juan, same question, and then I'm going to ask you a follow-up.
Okay. So like I said, we were able to open back in September, October with some events. So we took that same approach that Kim just mentioned of reopening. So we invited the media out, socially distanced, of course, and did a presentation and took the fans or in the media through the same processes that they would, from the moment they park to the moment they go to their seats, to the moment they order food. Everything else had app presentations with in-seat service, and where hand sanitizers would be, and we had staff cleaning for the media to show. What we did all that for the media, but what we did with all that footage is we created a video that we sent out to our fans, so that way, kind of to Kameron and Kim's know before you go type scenario, we actually showed them exactly what was going to happen. We showed the temperature screening. We showed the being asked the questions. We showed them that we no longer took physical tickets anymore. We were just all mobile now, and the same thing for food and beverage. So we re-educated a reopening of a facility and showed them all the aspects. We took them into the seats where seats were banded and where they can sit. We showed the person bringing, we went through the process of ordering food and doing that. So we do that, and now we will do it again to start this season, because some things will change. There's some things that we no longer have to do that we're changing that. So I think video and actual visuals to communicate that to the staff, whether it's on social media or in the season ticket emails or day of emails that they get, we did that as well.
Terrific. So I'm going to run over just a moment, and this is for all the attendees. We typically try to stop about 15 minutes before the hour, briefly tell you what's coming up next, and then our panelists have been kind enough, they will stay on and answer all your questions that you may have been generating through the question box. And so we'll get through every one of those. They'll stay as long as we need to. But before we get there, I think none of us probably saw him because he's so good at being behind the scenes, but many of you know that Juan has been an active part of the Super Bowl and its operations team for many, many years. And as such, he was at Super Bowl 55 and was actively in the middle of everything going on there as it relates to operating and helping support that event. Juan, I wonder if you could just take a minute, and again, we're paying attention to time, but you've got so much wisdom. If you could just take a minute and share with us maybe a best practice you saw there, and then something you saw there that you're going, okay, I saw that, I'm not sure it works so well.
Well, I'll tell you, when I first arrived, I thought we were going to be extremely challenged, because a lot of what happens at those sporting events and the preparation happens in those last 2 weeks or 3 weeks, even though there's been plenty of planning ahead of time. So a lot of face-to-face meetings and so forth happen. I was very surprised to see that through these same tools that we have with Zoom and Teams, et cetera, how much was still able to be done and accomplished. you know, I love the different ideas that they used. That while it became, you know, we banded seats here, there they used the cutouts to separate folks, and really the communication of everything that was being done and the why and everything was great with the fans. A couple of tools that you know, I'll tell you that I brought back with me is some interesting things that honestly I think I shared with you the other day when we were talking, that I would never have thought about it. But you know, all of our offices now are big open environments, right? The cohesiveness and the collaboration and everything. Well, during COVID, now all this plexiglass, et cetera, needs to be up to create now separation that we've tried to knock down those walls to say. Well, what they did there is they put many folks in suites. All along the building. My building only has 36, but some of these stadiums like Kim that have 1,000 suites, I'm exaggerating, but that's all of a sudden giving you 1,000 offices or 1,000 private workspaces and still have that cohesiveness that you can go out into some of the largest conference rooms in the bowl and sit socially distanced and still have a meeting and so forth. And I thought that was critical, which is something that I brought back and offered to our team here is, look, we can't put 36 people in our office environment. That's an open environment, but now we can bring 36 people and put them one per suite and still have that collaboration of both for mental health and for work production. Because I think the interactiveness we missed a little bit about. The other tool that was really, really critical and we've started using here as well is a meeting journal. What we have is, you know, if somebody has to quarantine for 14 days or so forth, and that contact tracing that goes back, you don't always remember who you met with and what you did. And one of the tools that was shared at the Super Bowl to use was an actual journal. Well, you journaled every meeting you were in, who was there, who were you the closest to. You could just circle the name. It's handwritten or electronic. Were they wearing masks? Were they not? Just so that you have a good candid image of what that meeting was about. And it was a tool that, you know, you kind of at the beginning it was like, really, I really need to do this. And all of a sudden you found yourself going into even if you were standing around 12 feet apart, you wrote everybody's name, or even if you were outside, you used this, and it was a great resource if something would have happened down the line. And you would have had to reference back. I was amazed that with that many people to run that game, because remember, the only thing that was reduced was the fan number, but the operations were still the same, maybe just a little less or a little different, but the numbers of people that worked that game were still the same. And especially the operational side of the game itself, broadcast, you know, halftime, et cetera. A lot of those things the numbers were still there, and how well everybody bought in and had that buy-in as to maintaining the health and doing those things, to me was absolutely amazing. Just that such an event could go off really without a hitch. And I think we looked at it as this was the springboard, even though many people have hosted events. To me, the Super Bowl showed that you can have 20,000+ people in an environment safely and efficiently by establishing. And Mickey and his guys at Raymond James, hats off to those guys. I mean, the David Mosses and all those, I mean, what they accomplished, I mean, they need to be prouder than any other Super Bowl, all other 54 Super Bowls. And we all say that it's a huge accomplishment every year, but what they did this year with Super Bowl 55 was a task like none other. To be able to have a game like that with that many people and everybody buy in. I think the NFL and Raymond James did an amazing job, and Tampa was an amazing host everywhere you went as well. So.
Great. Thank you for that, Juan. So I'm going to just real quick here give you a little look forward. Our panelists are staying. We've got some great questions coming in, so I'd like to just talk a little bit. Next week, if you haven't signed up for this, we're blessed to have Paul Turner, who is the Senior Director of Event Operations at AT&T. They've actually had fans as well in Texas at AT&T Stadium for NFL seasons last year. Paul's got some amazing insights and stories as well related to what they've done with their full-time and their event-related staff and dealing with all of the things that go on. and also just in general how they ran their venue for that. So be sure and make that when we want to have you. We also have 4 additional sessions coming up, and we want to have you there. Our third session on the 10th is with Michael Marion and Lisa Woods, 2 absolutely top-notch people related to employee feedback and evaluations. Many of you know both of them. You might not immediately think, well, Michael Marion on feedback, he's the best I've ever seen. He is a person that so wants to know how he's doing within his organizations, and the systems and tools he's used to help him become a more effective leader are phenomenal. Lisa is cutting edge in terms of organizational surveys and how to use that information and employee feedback. It's an area we all struggle with. We'll jump right back into the focus around our air handling systems. And before any of you non-engineers roll your eyes, take a breath. We all need to have a great working knowledge of this topic. And I encourage you to click the registration button and show up for this. Josh Robinson and John Lasita will be on. Both are experts. They'll be on with Mike Woolley, who Kim mentioned earlier, and Tom Williams and Russ. And this will be fun and interesting. It'll also be something where you'll have a great working knowledge of best practices around it. Our 5th system in this 5th session in this series is Reward Systems That Work. We'll have Patrick Scanlon from the Cleveland Cavaliers, who oversees their guest relations operations, has been there for a while, is really terrific, and Toya Laceria from Sofi, both experts in this. And so it's about how we catch our employees doing things right and tell them how we feel about it, so we get them feeling great and build that culture. And then our last of this group is analyzing your operations, and we have Rebecca Butt and Kim Baker both on. 2 people with very different organizations that have utilized an analytical approach to looking top down. And look, this is a chance to reset your organizations. As tough as COVID has been, being able to reset and know the tools to use will save you a lot of money at the end of the day. So that's our upcoming sessions. I'll kick it back now to questions, and maybe Russ, if it's okay with you, I'll kick it to you to help us walk through some of this.
Yeah, thanks. Really deep appreciation for the candid and direct feedback from Kim and Juan and Kameron. And you said so many things that are right in what I focus on and inspire me. But one of the things that I really hooked on, and regardless of the size or type of your facility, this concept of reopening again. Reopening usually comes with a new building or a major renovation or something like that. And if we start to change our thought process towards reopening and what we have to do to prepare to reopening, and also just in the back of your mind, not everybody that worked for you a year ago is going to work for you again. And so this is an opportunity to sort of look at your culture, your mission, your vision, your values, your organizational chart. Many of you have heard me say that organizations evolve for convenience. And you really need to think about, is your organization going to be ready to meet the challenges and expectations of the future? That and the partnership with your health department. Again, Kim said it perfectly. I felt like I was saying it myself. The idea that you don't want to meet these people in an emergency, and with Juan adding in the idea that you could contribute to their success, which builds a fundamental relationship with those people. I mean, this is simple gold, regardless of the size of your community, regardless of the size or type of your facility. So really took really great from that. I was just really pleased. So first question from Andrea Runner. Would the panelists be willing to share their communications and marketing know before you go and plans and videos? And I think not only these 3 individuals, but overall, and we talk about IAVM in general, listen, I don't know that I've ever asked anybody for anything and they told me no. So I'm certain I speak for all of 3 of these people. You're welcome to reach out to them directly. I know for those of you who know Paul, who'll be on next week, does a fantastic job of sharing information. And so the only mistake you can make here is by not asking. So just don't let that happen. Marianne Torres asks about plans to hire a COVID compliance officer, and Kim, perhaps this is something you want to. Do you have plans for a COVID compliance officer?
So we created a director of facility health and hygiene, which serves as our COVID, I wouldn't call it compliance officer, but it's for us, it's somebody that's really watching the science behind this, how it's evolving, and then helping translate that into how we need to adjust our operations. This person now oversees our cleaning department, and I mentioned previously is also our MBA testing officer. So it's she oversees all things COVID and has done a really nice job in that area. And this is something that we think will continue into the future. Clients as much and translating this science, which can be quite confusing, into our arena operations so that we're all working from the same page and helping us stay on that cutting edge. So it's been great to have a dedicated resource so that the burden isn't falling on all of us who are trying to get the building reopened. So it's been fantastic. And I'd be happy the job description that we created for this position, if that can be helpful. Much to your point, Russ, about like we've collaborated. One of the best things to me is this is an amazing industry, and COVID has really just brought us closer together. And you've said it, Russ, Juan offered it, like just the sharing and collaboration. If I can help anybody, I'm happy to help. So please, if I can share that job description, I'm happy to do so.
So Juan, how about you? How have you handled the COVID compliance issue?
Well, what we did is I'm going to go back to the listening, but what we did in inclusiveness, we started a COVID task force where every department has someone on the task force, including our chief medical officer for the team. So our athletic trainer, our chief medical officer for the team is part of, and then folks from the business side, and we all are on a COVID task force. I do chair it just from a facility side because I oversee a couple of different under my umbrella. So I lead it, but there's representation from everybody. And I think that's been the biggest thing is we don't only have one COVID compliance officer, we had 12. And I think it's really 12 people looking to what we've all agreed to, trying to distribute and have different eyes in different places and answer several questions. We all bring everything up before it's released. It always goes to the chief medical officer for his blessing, and then we distribute. But everybody kind of assumes that as part of the task force itself. All I am as the chair is a facilitator of making sure that we're talking and having those open dialogues.
So Kameron, I'm going to direct this next question to you, and I know Toya is going to be on a future session, but Mario Batts asked, what resources are you using for online management training? And I know you all are using some online management training, or maybe Kameron first, and maybe Richard.
Yeah. So for us, a lot of our stuff is based out of Google. Google is a big component of our partnership here in the building. So we work with our IT department to use a lot of Google's resources to be able to develop some of our trainings, and have been creative, leveraging some of that relationship to be able to develop some kind of creative things that work for our operation. It's not rocket science. It's just stuff that you just have to kind of research and find those things to utilize. That's pretty much what we've been using a lot for our training inside of things. Nothing earth shattering.
Richard, you got a comment?
Yeah, I just quickly say, like most people that are wearing the training support hat, we've either had to pivot and learn how to live in a virtual world, which most of us couldn't spell, 16 months ago, or suffer. And it's actually phenomenal in many ways. While I don't think it'll ever replace in-person training, the virtual capabilities are so unique and so solid. We're doing, for example, in our own case, we're doing lots of webinars, but we're also doing many Zoom-based related calls where we're actually able, as I mentioned earlier, small groups. We're actually able to do small groups and have dynamic learning. We've done mission, vision, value development. We've done team building. We've done customer service, guest services training. And I think in many ways it's actually more effective than in person because it's so much easier to keep people engaged because you've got the small group and the eye contact, and you've got them, as I think Juan mentioned earlier, in short sessions, 1 hour. It's hard to keep people on for more than an hour, hour and a half. So yeah, I think there's great upside opportunities.
Michael Marion asks a question with regard to, don't expect to be doing events until late summer, early fall, when all of these things sort of level out. Looking at having a job fair when the social distancing is relaxed. before the first events, leaving some time for training. He expects most folks to come back, but also feels like he needs to shore up for the coming event load. And, I've talked a lot, if you've been on any of the other things that I've been on, I've talked a lot about the expectation that people have moved on. Both your permanent staff, people who have been laid off and furloughed, and your casual staff who've had to go on to other things. And there's certainly a brain drain, the institutional knowledge. A lot of the people that you might be counting on to come back may not come back, and that might be because they've gone on to other things, or it also might be because of just a discomfort to come back into a mass gathering environment. And all of our panelists today, and we're all agreed that there's going to be an important psychological jump for people to actually get comfortable coming back in a mass gathering environment. And so, the idea is, what are people doing? What are you guys thinking about in terms of preparing to have to sort of refill in or reconstitute that staff? I would tell you that I think that casual staff is going to be in demand in a lot of ways, and it could be a real challenge. Kim, do you want to start with that?
Yes, Russ, thank you. I agree with you. We are just, we're not even open yet. So I don't think we have our hands around yet exactly what this means in our part-time workforce. Our full-time workforce, unfortunately we had layoffs, several months ago, just a sad reality of being a year without any sort of revenues. And so we've had to repurpose people. We've had people really acceptingly taking on new and enhanced roles. And it's been great to see that perseverance. But Russ, I think from my perspective, I worry about what that impact is going to be. And we have surveyed, but I don't want to sit here and pretend like I really understand exactly what this is going to look like, because we aren't back with fans yet. So it's something that's high on my list to monitor. So I don't have any additional insights there, but that's how I'm looking at it.
Cam, you haven't had fans yet. So what, if any, concerns do you have in terms of being able to ramp up the sizable staff that's going to be necessary to open SoFi Stadium?
Yeah, I think you said it right, Russ. The ramp up, getting the people is really going to be the concern, and being able to manage that, getting those numbers. So what we're doing right now is really starting to go back into our staffing plans, going back into our dot maps, going back into our physical layouts, and really start to refocus again on, okay, do we really need to have, fortunately now that we actually were fortunate to have those football games, allow us to be able to see, do we need to have a person here like we thought we would? Maybe we can eliminate some of those positions to be able to kind of get a little bit more efficiency in our staffing plan, and hopefully not have to have as big a call. And then just try to find, really working with our partners, opening the conversation with them early on to start to say, okay, we have a few partners. What can we do to partner together to have larger job fairs to help to each other and being able to meet our different demanding needs that are going to be needed around the building.
Juan, you did reopen. What did you find? Did you find that your casual staff returned in the manner you thought? Were there any challenges for you?
No, actually, I saw everything as a blessing. I mean, not only did we lose some staff, yes, but it was part of the healing process, as I like to call it, of getting back. And I think from a mental health standpoint and everything, those job fairs and talking about getting back to normal actually gives people hope, gives people inspiration. So, but to answer your first question, is we had a large contingent of our staff return, and I would say in the neighborhood of 90 to 95% that were hungry to come back and do it, only because many of their full-time jobs that were lost. So this was a way to have some type of revenue that would come back. But I tell you, just the comments of, like, in the trainings before the meetings, man, we can't wait that we're coming back. We can't wait we're coming back. So to Michael Marion's question, the thought, timing is the biggest thing. But I think just the thought of having job fairs is going to help people heal and get a community back talking about getting back to normal when that time is right in each community.
Hey, I want to stay with you for a second. Ray Darabiji asked a question about how do we handle team member mental health and wellness, both proactively and reactively? You made the comment, Juan, about that people are emotional and scared. And I think all of the participants touched on this during this conversation. So anything specific with regard to mental health and wellness?
Is that for me, Russ?
Yeah,
I'm sorry.
yeah,
Okay,
yes.
yeah. I think that the biggest thing was creating virtual opportunities and letting people know that we were all there. I think from an emotional and mental side, Ray, our president would pick up the phone and call a person that he doesn't usually deal with, or I called another department. You know, when we happened to rebrand in this process of COVID, we actually, all the executive at the holiday time went and delivered personally a gift, socially distanced with masks and everything. And we had that personal interaction with many to help in that. And I think that's what people really miss on the emotional side, to show people that you care. I think Richard's quote earlier it's and I'm sorry, I may hatch it, but it's not about how much you know, but it's about how much you care. And I think that right there went so far in the emotional uplifting of many of our staff. And we did that, and creating environments, you know, those virtual happy hours and stuff that every company has done, and just conversations and having their kids. I mean, tell me who doesn't bring a smile to their face when somebody raises their kid or their puppy or something. In that all leads to that encouragement and openness to kind of have those moments. And it's not about a doctor. It's just about love and care. A little TLC goes a long way.
So the nice part about what you said is that most of what you said didn't require budget. It just required a personal and human commitment to make some contact, to make some effort, to do something extraordinary on the other side of that. Kim, same question about mental health and wellness. What are you guys thinking?
I love what Juan has done. I think I may steal some of that. And for us, it's been town hall. It's been virtual meetings. Our president does what we call the daily. It's an email at the end of the day that really is a personal story from somebody in the company. And so we've really gotten to know each other through that process. Yeah, this is Black History Month, so a lot of our Black staff are really sharing their personal stories. And so it's really been connecting on a level we haven't done so before. We do the virtual happy hours as well. Those have fallen off now that we're back into games at Chase Center, but we still put a lot of focus on that. We've done town halls with our team doctors, again, to educate people about the virus. The doctor has been fantastic. He just did one recently about vaccines and answers questions about vaccines. We've had a team psychologist on to help us understand mental health and wellness. So we've just really been staying in touch with one another. I've got 3 times a week meetings with my direct reports. Every week we do a large arena ops meeting where we let some of the younger staff host those meetings. So just really thinking outside the box, being innovative and really checking in. I've done personal calls to staff. We created a CARES committee, and that CARES committee touches base with the staff to help percolate up any issues that the staff are feeling or any trends that they're seeing with the staff. So it's really just staying in touch. It's the same thing Kameron and Juan and you all have said here is it's really about you're leading with your heart. You're not leading with your P&L because getting through this, we have to get our staff through this, and then that will be the best.
Okay, next question came from Kelly Hadsall. Kameron, that's just going to go to you first. Will you keep some of the new technologies or techniques that were rapidly implemented, such as virtual meetings, even when and if people are on site, and increased deployment of mobile technology to job classifications that pre-COVID would not have been given access, flexible work at home, scheduled for admin days? What is it that you've been forced into over the course of the last 11 months that you think will actually remain a part of your work environment?
I think the virtual and work from home opportunity will continue for a while. I think that's definitely going to allow us to be able to extend our communities a little bit more, to be able to meet people instead of always having people be able to be present on site, to be able to connect with them at home. Is definitely an opportunity I think we'll continue to have. we're looking forward to continuing to do a lot of virtual training as we ramp up. We will require some things to be on site, hopefully, if we can get some social distance things, but I think that portion will make it a little easier. I also think that the work from home allows us to be a little more flexible with at least from our front office staff, allowing us to be maybe a little bit more flexible in their ability to get things done and not always have to be worried about coming all the way commuting to work, but they can just do it at home and get a lot more projects done. I've seen a lot more of our staff be a little more productive actually being at home than being in the office in many cases.
I'm going to find myself in agreement with you. I think the stigma of working at home is sort of now gone. You know, it used to be that the boss had a stick and held the stick over you to make sure that you were logging in and working in your space, you know, for the period of time without really much consideration to what you are actually producing. And so I would think not just in our industry, but in most industries, the idea that you can be and have proven to be capable and trustworthy enough to be productive at home. I certainly think that that's going to continue. And while we all hate Zoom right now, I do think that that those kind of virtual environments and all that are going to continue. So. Max Long, pre-COVID, there was a strong focus on venue safety and security, with the focus being shifted to cleaning and disinfecting. Are you concerned about the importance of venue safety and security will be neglected? And actually, I'm going to take this first. You know, while a lot of the attention is on COVID, it doesn't mean that all of the other things with regard to safety and security, like they haven't gone away. They haven't dried up and gone away. You know, with the absence of mass gathering, that has changed a little bit of the dynamics. It's changed a little bit of the risks. As we start to bring people back together, those risks will be amplified. Will be amplified again. So, I don't think. I also think that with most people being home for a great period of time, anybody who did anything would be noticed by more people quicker. I think that it's a slippery slope. We want to make sure that we're not abandoning the commitment to safety, security, and certainly from a risk management standpoint. And I would hope that everybody has a better handle on how important risk is in your thinking overall. I think that COVID has helped us understand that more than just the basic, you know, hard escape safety or security protocols and procedures we use. I think these things will balance out as some of our attention focuses away from the current pandemic and towards bringing people back into facilities. You will see that continued emphasis. But safety or security people in particular haven't given up on their responsibilities. I mean, they're just as busy as they always have been. Is the panel and their venues adopting mobile ticketing only and cashless transactions? Juan.
Yeah, so everything in the facility is 100% cashless, and everything is mobile. So we were a big ticket, you know, still letting people do tickets, and we had a totally archaic POS system. All that coincidentally during our time changed. So now everything is cashless, everything is mobile in every aspect of what we do in our business on a daily basis. So, and that was totally new. And honestly, the POS was done for our first and only opener last year. But when we went into COVID, everything then turned into that. So it made it a little easier in that process.
Yeah, essentially, and understanding that there are resource and cost issues and all of that, but I would think you're seeing it in your daily life, you're seeing it in your transactions and everything from your dry cleaner to your convenience store and all of that. I think cashless is here to stay, touchless is here to stay, you know, regardless of vaccines and the sort of the ramping down of the pandemic overall. I think it's also okay to take some time to get there. Although you'll have a lot of motivation because your guests will be the first people to tell you that they don't want to touch anything and they don't want to handle money and all of that. So you can expect that that's going to be continuing as we go forward. Would the panel have any comment or insight as to when venues open in the summer or fall? Fans would be an increased presence or demands on event security. Kameron, do you think there'll be more event security because of what we've gone through?
I think there will be a heightened awareness. Yes, I think there will be. I think there'll be some. I think The staffing will, as far as security, will be a little bit more increased because obviously people are coming back out. We want to make sure to keep people distance. They may come in a different uniform. Maybe they're considered COVID, reminders or ambassadors to remind people of social distancing. But I think that there'll definitely be a little bit more personnel involved to make sure that people understand the importance of remaining socially distanced, keeping their areas clean and area spacings.
So a follow-up for you, have you changed at all your thinking or your training emphasis with regard to de-escalation techniques? And because we know that there's a lot of controversy between social distancing and masking, that kind of thing.
Yeah, definitely a part of our training is going to be definitely how do you de-escalate. Definitely a part of the IABM discussion group that talks about de-escalation and really trying to find ways to be able to incorporate as much as we can. Give people again, I used earlier the term empowerment. We want to set people up for success. So whenever we can give them tools and resources to be able to make it successful and being able to provide and meet our service expectation, we're going to do that.
Russ,
Go ahead.
I was just going to say, if I could just interject, and it's I totally agree with what Kameron just said in your question, and it's a big piece of even how we've shifted our own training. So de-escalation is critical, and so is dealing with stress. Juan brought this up very early on in here in terms of how people are employees. All of us are dealing. COVID's changed the way we are emotionally. It's challenging. Even our mental health is at risk in a lot of ways because of what's happened. So a big part of what we've learned is that we need to be helping event staff cope and full-time staff and everyone cope with the kinds of stress that they're dealing with. We know it's a fight or flee sort of scenario, and teaching people how to basically diffuse that so that when they get involved in a situation, they're objective and not a participant, and that their de-escalation techniques actually work are critical.
Juan, did you do anything different with regard to that, and what have you found with regard to what's happened in your stands?
Yeah, it's funny, and it's not funny. It's difficult, but I was going to say that everybody should have a plan for that person that's going to refuse to wear the mask. Your whole messaging of no mask, no service, if that's what it is, keep that in mind, and then have a plan B for the ADA issues that come up. Maybe it's, one of the things that we're talking about here is no mask, no service, or is it no mask, no shield, or no shield, no service, so that you can have different plans of how you're going to deal with different things. But yes, we for the first couple of games, we were a little bit more lenient. We even put a couple of fans to not have the negative publicity around it that refused to wear a mask. We put them in a suite by themselves, away from everybody. And that was part of the de-escalation, because at the moment they were getting very loud and very boisterous, and you're not going to tell me what I can or can't do, that type of thing. We did that for the first game. Every other game we were very stringent, to that whole no mask, no service. If you don't have it on, we're going to ask you to politely to leave, in a very nice way, kind of a Patrick Swayze in the movies, right? If you tell them not to put it on, just be nice. You can escort them out, but be nice. That type of thing, and really coaching the staff to that. But one of the things that and sorry to ramble here, is you also, the stress level of the fans as well. They're frustrated. They're getting out. They want to do things. So how we would normally maybe not put up with something in a certain way, to use that term, we're a little bit more lenient and explaining more the process. The science trumps emotion goes the same to the fan as it should to the staff. And I think that's the biggest thing, is kind of that guilt factor. You're doing it's for others' protection, not so much for yours if you don't care.
Very good. Victor,
Russ,
go
if
ahead.
I could add, so
Yep.
piggyback on what Juan just said, and I think I like he said being nice. That's the key thing. I think we have to, in this COVID era, service is kind of taking a back seat a little bit, to just getting the end objective taken care of, which is mean delivering whatever you need to get to. But we got to remind folks the importance of starting and ending on a positive note, and trying to find a way to make sure that it's a positive experience for the guest. And I think that's the things we're trying to do with our staff, is really going to be focusing on reminding them on key words, key phrases, things that we can use to help to provide that great experience for people.
Victor Cohen asks, for those organizations that have subcontractors providing staff, security, et cetera, should we be expecting rate increases? That would be yes. Not to be flippant about that, but there are COVID costs. I think there are going to be costs for competing employees and staff. And I don't know, Victor, you and I have known each other a long time. Have costs ever gone down? So again, not to be flippant, but yeah, I think there will be consequences, and the thought process will be to pass those consequences out. And maybe they're more palatable if we could actually explain why some of those costs are actually happening. So our last question is from John Hampy. How is everybody handling bag check process, both from the standpoint of staff as well as guests, trying to be contactless? Juan, are you contactless on your bag checks? Have you restricted bags? What have you done?
We've restricted bags. So again, we were the norm that we allowed a lot and just check bags. Now we went bagless, went to the, I'll call it the NFL kind of criteria of a clutch that you can open and see. We did not go to the clear bag policy. We just went to no bags, and the only one you can is a clutch purse on that. So yes, we went to that level.
There are a lot of trends in that. I mean, that was something that was already being successfully administered collegiately in a number of collegiate stadiums and collegiate facilities. I think a lot of people have embraced that early on in this as an opportunity. I think the safety and security people are delighted by that, because the less opportunity for bag searches and all that to fail, the safer we are in our environment overall. We have a last question underneath the wire from Judith Brown. Have any of you rearranged the seating for your disabled guests? And Juan, I'll ask you that as well.
Yeah, we took the same approach as we did with our seating of everywhere else, creating that social distancing and creating opportunities in some areas that maybe because of television or something, reconfiguring a camera platform to be a disabled section, et cetera, because some things have changed and you've been able to put cameras in actual seating areas because you're not using them, et cetera. For us, the league did not allow us to have anybody essentially within 20 feet of players from the wall. So that in our building knocked out the entire lower bowl because we only had 10 rows. So when we opened, we couldn't do that. So a lot of the things that we were able to do opened opportunities for others, for cameras and so forth, so that we could have more areas open for our disabled guests. But as everything else, the demand really wasn't there, even though it was available.
Hey, thank you. That ends our questions. I do want to share with you from my perspective. It is important that we have these conversations. And we see webinar, I tend to think about somebody talking at you for a period of time. But as you noticed in this was a conversation amongst industry experts and people who are living various phases of this. And the whole point is to bring value. So Richard, back to you.
Richard, you're muted.
I didn't really say anything.
That was the best things I've ever heard come out of Richard.
It was ever. Literally one of my best quiet points. It was, again, just to thank our panelists, Kim, Juan, and Kameron, and to all of you for attending. We had a super large group. Please be sure and register to be a part of next week's session with Paul Turner from AT&T. Same time, same station. And until then, be safe, and thanks so much for being with us. Thank you.